Now, India, in fact, Indian or people of Indian descent in the United States have the highest income of any ethnic group in the United States, including whites. And indeed, India is sending the best and the brightest to the United States. A survey of 300,000 people of Indian descent living in the U.S. found that 75% of them have tertiary education. Now, that's quite different from the bulk of immigrants into the U.S. from Mexico, where 13% have tertiary education. So Mexico is producing a lot of low-wage, low-skilled workers with either a high school education or a primary education or less that are entering the U.S. labor force, whereas India and many African countries are sending the best and the brightest. We've done a project in Malawi. It was a very short project, training writers in how to use entertainment for changing social norms on reproductive health issues there. Malawi has nursing schools that crank out nurses in large numbers. What is going on in Malawi is very interesting. MDs are now going into nursing school in order to get a nursing degree, because with a nursing degree they can move to the UK or the United States and get a nursing job at 14 times the salary that they're earning as doctors in Malawi. And who can blame them? Malawi has not done much about its population growth, and so it is mired in poverty, while the people who can help lead it out of its crisis are moving to developed countries who are happily poaching them because it's a lot cheaper to take somebody who's been trained by Malawi as a medical professional and put them into a job in the U.S. than it is to build the number of medical schools and nursing schools that we need to service our population. So indeed, part of the story of immigration, and it's a small part in terms of numbers, is the fact that developed countries are being subsidized for the best and the brightest by the poorest countries that are training people who then move to the developed countries, saving the developed countries huge amounts of money on training their own people, and providing an incentive not to train people or creating greater competition on wages, etc., for those who are going through schools of medicine, engineering, or science. In fact, in Africa, the situation of migrants to the U.S. because they can't just walk across the border is this: 95% out of 128,000 African migrants to the U.S. were highly educated, and very significant percentages of other migrants from other African or other countries outside of the Western Hemisphere are highly educated. So outside of Latin America, the picture of migration is quite different from what we mostly hear about. One of the things that I think is probably speculation on my part is that emigration of skilled workers probably worsens dependency ratios, because these are young people who are educated and moving out of the country, leaving those who are not educated with larger family size behind. So making the total dependency of young people on the working population greater, thus inhibiting economic growth. So overall, I think the impact on Africa and Asia is one of depressing economic growth. Malawi now has 2 doctors and 26 nurses per 100,000 people. The similar ratios found in Angola, Liberia, Mozambique, Sierra Leone, Tanzania, And it's the result of our not having enough medical schools in the U.S. and the U.K. The U.K. has now adopted procedures to try not to poach healthcare professionals from low to middle income countries, and yet still Malawi lost 600 out of its 1,000 nurses trained in the last year of record to emigration. The U.S. really has not put any procedures in to protect developing countries from brain drain. BBC reported that 7,000 nurses arrived in the U.S. from the Philippines last year. Philippines loses over 13,500 nurses per year. A total of 100,000 Philippine nurses live overseas. In the U.S., a majority of the 730,000 Philippine migrants are highly educated. So the Philippines, where I will be in 2 weeks, is another victim of this brain drain. In many countries, including the Philippines, there is a fear that this emigration of their skilled workers will lead to a collapse of the healthcare system. And indeed, you don't go to a hospital in many of the countries I visit if you can possibly avoid it, because what's left behind are the people who couldn't get visas to move to the U.S. or to the U.K. Education is a mantra for economic development in developing countries. But because of the brain drain, education is in many ways a losing game for these countries. It's not leading to development because they're losing the people they're spending the money to educate. Half of the 400,000 Chinese are highly educated in America. 53% of the 300,000 Koreans living here are highly educated. 60% of migrants from Egypt, Ghana, South Africa are highly educated. And this is true of all the biggest countries sending migrants to the U.S. in Africa. Guyana is an outlier, with 70% of the people who have moved to the U.S. having a tertiary education. So again, Guyana has lost the best and the brightest to the U.S. Ghana, 26%, Jamaica, 77%. There are many countries outside of Latin America that have lost, where the migrants to the U.S. represent 30% with higher tertiary education or higher. So, and it's not just the U.S. I've mentioned the U.K. It's also true of Canada, many European countries, Bahrain, Kuwait, Oman, Qatar, United Arab Emirates. So in terms of the welfare and the economic development of the sending countries, from what people in this country view as an immigration problem, there really needs to be a gathering of the nations of the world at the United Nations to talk about how do we help the developing countries get out of this trap that they are in, where their economies are mired in poverty caused by, in part, high population growth, and they're losing all the people who can help improve those economies to countries that are essentially predatory, benefiting from them by taking the best and the brightest. Thank you.